gMed was established in 1997 to create a better alternative to the paper medical chart. We were not satisfied with existing electronic medical record systems because they could not fully address the need of medical specialists. A significant part of the patient information and revenue for specialty practices like gastroenterology, urology, and cardiology lies in specialized procedures and tests. At gMed, we are committed to creating a safer, easier, and more cost-effective way for specialty practices to work. Physicians are in a dynamic and rapidly changing environment that demands paperless systems, but generic alternatives often fall short and don't provide a solution for more efficient practices. At gMed, we understand we need to go beyond generic solutions.
South Florida Cardiology is no stranger to the value of electronic medical records. Our practice has 18 physicians, over 160 employees, and 15 offices. An EMR ensures we offer a premier level of medical care and maintain profitability. After using a generic EMR for 10 years, it was clear the lack of integration and inability to go completely paperless was limiting our practice. We were happy with our previous solution initially, but over time, costs rose and reimbursement decreased because proper documentation was not possible. Notes were being captured, but all cardiology-specific tests and procedures were being done on paper forms. This, coupled with the fact that each time we pulled a patient's paper chart, it cost us $4, led us to seek an alternative. Right from the get-go, we knew gMed understood how important it was to have a completely integrated solution. You want to update the chart and then we can find out where we are at this time? Alternatives were either higher in price or maybe efficient at scheduling and billing, but couldn't incorporate a complete package. gMed showed a willingness to work with me in developing software that was user-friendly for cardiologists and incorporated all elements of the practice. Let me just get your chart up. The gCare solution is allowing South Florida Cardiology to go completely paperless. All cardiology procedures and tests, like echocardiograms, carotid ultrasounds, and nuclear stress tests, can be created electronically. gMed worked with us to develop a training strategy for our practices, but we ended up surprising them a bit. The solution was so easy to adapt that we were up and running within 2 or 3 days. How are you, sir?
Oh, fine, thank you.
Good to see you. Hi, how are you? Utilizing gCare is a big time and money saver. We are spending more time with patients, seeing more patients each day, and documenting more thoroughly. The scanning process alone is saving hours each day. It used to take 1 or 2 hours to review and file reports with nurses. We have cut this to 10 minutes. Another time and money saver is the HIPAA-compliant patient portal that will allow patients to schedule and check appointments, receive bills and test results, check prescription information, and review other issues important to them. We are streamlined from the top down. All elements of patient care, procedures, billing, scheduling, you name it, are automated in this system. After working with the gCare system, this was a no-brainer. From our evaluations, the EMR should pay for itself in 12 to 18 months, if not less. We are no longer working between paper and electronic charts. Our staff is more productive and our costs are lower. Most importantly, our physicians can truly focus on patient care rather than practice management. We have already implemented gCare at 2 of our offices, and there is only upside to implementing across all 15.
gMed designed a system that thinks like a cardiologist, giving doctors a tool that takes the focus off practice management and puts it back on the practice of medicine. We fully automate cardiology practices, including all visits, tests, procedures, billing, imaging, prescriptions, appointments, and the list goes on. Our focus is the same as our customers: forms need to match those of their paper counterparts. Rather than giving physicians a system requiring high customization, gMed has cardiology-specific forms that are intuitive. We thrive on user feedback from forums and conferences. Our goal is to increase functionality and efficiency. Making the solution user-friendly is a key to adoption. Practices want a solution that is easy to learn and use. At gMed, we keep it simple, specialized, and flexible to help drive a quick return on investment.